Hi, my name is Josh Lopez, and today I'll be talking about COVID 19. COVID 19 is a disease that was newly discovered in Wuhan, China, and has affected more than 62 million people across the world, according to the Georgia Department of Health. Just in the United States, it has affected more than 13 million people with over 265,000 deaths, according to the Centers for Disease Control and Prevention. This is a very serious disease, but it is much like a cold or flu. It has very similar symptoms, but as I said, it is much more serious and sometimes can be fatal. Coronaviruses are a virus that cause a form of illness, as I said, in both animals and humans, and it can be contracted through the air or infected surfaces or objects such as doorknobs, door handles, gas station pumps, and even pin pads when you check out. What happens if I were to get it or you were to get it? There are very many symptoms, as I said, much of them similar to the flu or the cold. Some of them are runny nose, congested nose, cough, sore throat, loss of taste or smell, headaches, vomiting, being nauseous, diarrhea, body aches, chills, fever, and even sometimes being fatigued. According to an article done by Johns Hopkins Medicine, it is also seen that pneumonia has been seen in almost 15% of those who contracted COVID 19. Pneumonia is when fluid gets in the lungs and causes it to be difficult to breathe. This is often the case when people go to the hospital and get hospital care. And this is often the case of why this illness can be fatal because it creates such a hard time breathing. Some people end up passing away from this, unfortunately. This is why it is so serious and much more fatal than the flu, cold. Almost all symptoms take around 2 to 14 days to be seen. Sometimes it takes longer, sometimes it kicks in right away at 2 days. It is also seen that some people don't experience all symptoms. Some just experience some, such as a runny nose and a sore throat. They don't have fevers, they don't have body aches, but if you are ill, it is important to get tested, wear a mask, stay away from others, such as if you were to have it, because, as I said, you never know if you do have it because not everyone does get all the symptoms. If you do test positive, it is recommended that you stay home, quarantine for 14 days, stay away from others, such as family members and friends. Some exclusions do apply, such as you can be around others for 10 days after symptoms first appeared. It is also recommended that you can see others when you have gone 24 hours without a fever and other symptoms have improved according to the Disease Control and Prevention. And what steps can I take as a precaution? So it's important that you wash hands frequently, you wear a mask, you social distance at least 6 feet from others, and avoid big social gatherings, avoid touching your eyes, nose, and mouth, and disinfect and clean areas that are frequently touched. So, as I said, such as door handles, counters in the household, just places that are frequently touched by anyone. According to an article done by the University of Maryland Medical System, it is important that you also wear an effective face mask. So, effective face mask is cloth face masks that have 2 or more layers of like actual cloth rather than just one, because it has seen that the virus can get through that one layer of cloth. And also another effective face mask is non-medicinal masks, such as the blue ones that we often see. These face masks do cover the nose and the mouth, which is the most effective way to wear your mask. It is also stated that you must wear your mask at all times, especially when you feel ill. If you have COVID or if you had COVID, you still need to wear a mask. You are not immune to it. You still can contract the virus once again. and you still need to wear a mask outside. It is often thought that just because you're outside, you can't contract the virus, you're in open air, but that is wrong. You can still contract the virus. It is airborne, so the chances of you contracting it outside rather than inside are less likely, but you can still contract the virus. You're not fully safe without a mask. Thank you.